I am a doctor who has seen people die from vaccine-preventable diseases. And when I see outbreaks numbering in the thousands and people dying once more from vaccine-preventable diseases, particularly children, it seems more than tragic.
It has nothing to do with me. I wasn't in any of those countries. I've done a better job at limiting it than any country in the world. And you can talk to Governor McMaster about that and Governor Abbott about the help that we've given them in Texas. We know how to control the outbreaks.
What we just witnessed is more than a political disagreement. It's a clash of authorities. When Senator Bill Cassidy says, "I am a doctor," he isn't just asking a question, he's pulling medical rank. He is challenging the Secretary's rhetoric with the weight of clinical experience. On the other side, RFK Jr. is employing a classic global shield defense. By pointing to Mexico, Canada, and Europe, he's attempting to decouple his personal brand from the rising measles statistics. But as the chairman pointed out, the trust gap is the real crisis. The question remains, can a Secretary of Health effectively lead if the medical community doesn't trust his diagnosis of the problem? Let's watch and decide.
We're joined today by the Honorable Robert F. Kennedy, Jr., the 26th Secretary of Health and Human Services. In his role as Secretary, Mr. Kennedy is responsible for overseeing the nation's civilian federal health agencies, which support direct services for over 150 million Americans and keep all Americans safe by supporting sound science and through the regulation of medical and consumer products. I look forward to hearing from you today, sir. Thank you for joining us.
Chairman Cassidy, Ranking Member Saunders, and members of the committee, thank you for the opportunity to appear before you today to talk about the President's 2027 budget for HHS. We stand at a generational turning point. Our children are the sickest generation in modern history, and decades of failed policies, captured agencies, and profit-driven systems caused it. Parents across the country demanded change, and we are delivering it. We're ending the era of federal policies that fueled this chronic disease epidemic and replacing them with policies that put the health of Americans first. President Trump and I are challenging the status quo and the institutions that defend it as we work to make America healthy again. In just 15 months, HHS has delivered historic wins. We negotiated most favored nation drug prices with 16 of the largest drug companies, so Americans no longer pay more than other people in wealthy countries for the same medications. We're bringing real transparency to healthcare pricing so that patients know the cost of care before they receive it. I use the full convening power of the federal government to bring health insurance CEOs to the table to reform prior authorization, and I convene the 405 biggest tech companies in our country to end information blocking and allow American patients access to their health records on their cell phones for the first time in history. We're cutting red tape, speeding decisions, and demanding transparency. We're also cracking down on waste, fraud, and abuse. This year, HHS and USDA issued new dietary guidelines that put real whole food at the center of the American plate. We flipped the food pyramid upside down and sent a clear message to Americans: eat real food. HHS has also opened the door to partnerships with industry, trade associations, nonprofits, and advocacy groups. More than 50 medical schools have committed to expand nutrition education from an average of just 2 hours to 40 hours. Food manufacturers are stepping up too. More than 40% of the food industry has committed to phase out petroleum-based dyes by year-end, and many have already eliminated them. In conjunction with these efforts, FDA approved 6 natural food colorings from fruits and vegetables. Through President Trump's Great American Recovery Initiative, HHS is matching compassion with action to help Americans break the cycle of addiction. At HHS, we are prioritizing patients with ultra-rare diseases and their families and driving faster access to life-saving treatments. We're restoring gold standard science and integrity across the agency. We're protecting children from sex-rejecting procedures that expose them to irreversible harm. We're eliminating outdated and misleading warning labels on hormone therapies used to treat women during menopause. We're strengthening oversight of organ procurement. We're implementing Operation Stork Speed to ensure the safety and quality of infant formula. We're applying that same focus and urgency to rural America. The Rural Health Transformation Fund delivers the largest investment in rural health in our nation's history. $50 billion over 5 years to strengthen rural hospitals and ensure Americans can access the care they need no matter where they live. HHS announced more than $135 million investment this month to expand rural residency programs and nutrition services. The data is clear. When physicians train in rural communities, they are far more likely to stay and serve there. The president's budget puts all these priorities in action. It invests in prevention because preventing disease costs less, delivers better outcomes than treating it. As my uncle, President John F. Kennedy, said, progress is a nice word, but change is its motivator, and change has its enemies. We see those forces clearly: entrenched interests, defenders of a failing status quo, and institutions that put profits ahead of the American people. That resistance underscores the urgency of this moment. We can reverse chronic disease, improve public health, and lower costs. I stand ready to work with this committee and Congress to seize this opportunity to implement and codify lasting and generational reform in American healthcare. For our country, for our children, and for the health of the American people, together we can make America healthy again. Thank you.
Thank you, Mr. Secretary. I think you've given a couple of these recently. You hit it right on time. I shall begin. Mr. Secretary, as I mentioned in my opening statements, I'm concerned that one of the Biden administration's pro-abortion policy, which is the removal of the in-person dispensing requirement for chemical abortion drugs, is still in place. And by the way, Senator Sanders objected to me objecting to that. We're speaking about people ordering drugs and then tricking a woman into taking them or coercing them into taking it. And these are subject to criminal charges in courts right now. We should all be opposed to that. Secretary Kennedy, why has the department not acted with greater urgency on reinstating the in-person dispensing requirement?
Senator Cassidy, I appreciate your comments. I unfortunately will not be able to talk about that.
I thought that might be the answer, which is frustrating because this has been litigated for years. At some point we'll need to, but I thought that might happen. So moving off the litigation, last month my colleagues and I asked you to address unapproved and misbranded chemical abortion drugs coming from international providers bypassing FDA. The first Trump administration worked on the issue, but the problem continues. Why hasn't the department taken steps to stop the illegal importation and sale of counterfeit and unapproved abortion drugs?
We take our responsibility seriously to prosecute people who are selling misbranded drugs, and I can talk to my enforcement unit at FDA to figure out why that's not happening to your satisfaction. But as far as I know, we're doing that to the utmost possible.
That is not the case. Put it this way, maybe as much as possible, but that would be no effort whatsoever. And so I say that because however you feel about these issues, illegal and counterfeit drugs being sold and imported should be a common concern. Next, Mr. Secretary, you have talked about restoring trust in the agency around the issue of immunization, and people lost trust during the pandemic. But I think it's safe to say the trust gap has worsened over the last year due to false statements about safety and efficacy of vaccines for preventable diseases like measles. Now, I am a guy who has seen people die from vaccine-preventable diseases.
I didn't hear you.
I am a doctor who has seen people die from vaccine-preventable diseases. And when I see outbreaks numbering in the thousands and people dying once more from vaccine-preventable diseases, particularly children, it seems more than tragic. Now, the CDC director, I applaud. You have said in a previous hearing that you were not involved in her selection, but you agree with President Trump's selection. I've not met with her yet formally, but I agree as well. She seems to be a qualified person.
I did not say that I was not involved in her selection.
I didn't follow, but so my question here, with the new CDC director, whoever she or he is, there are currently political appointees at CDC who have worked to undermine trust in immunizations. Will the new director, whoever she is, have the right to make decisions independently of those political appointees and/or replace them or otherwise reassign them so they cannot continue to actively undermine trust in immunizations.
Your characterization of the political appointees is wrong, and the CDC director has that power.
Now, so she will have, if she wishes to make a decision independently of them, she shall be allowed to make that decision independently. That's correct?
Yes.
Okay. That's pertinent. This summer, we're hosting the World Cup and celebrating America's 250th birthday. Tourists from all over the world will come to the United States. Unfortunately, some of them will bring vaccine-preventable diseases like measles. And unfortunately, our measles immunization rates have fallen, which means that this increases the risk of a measles outbreak in the U.S. What steps is HHS taking to address the outbreaks that may arise from the World Cup and the folks coming here?
Mr. Chairman, we've done better at controlling the measles outbreak than any country in the world. This is a global outbreak. It started before I came to office. Most of 80% of the children affected are over 5 years old, which means their decision not to vaccinate predated my appointment. We have limited that last year to 2,200 cases. Mexico had 3 times that much with 1/3 of our population. Canada had double that much with 1/8 of our population. Europe had 127,000 cases the year before. We have a global pandemic. It has nothing to do with me. I wasn't in any of those countries.
We should not be comparing ourselves.
I've done a better job at limiting it than any country in the world, and you can talk to Governor McMaster about that and Governor Abbott about the help that we've given them in Texas. We know how to control the outbreaks.
The question was, what steps has the administration taken to track the diseases that would come in potentially through these? You're pointing out that other countries have outbreaks, which increases the likelihood they will bring that here, and our immunization rates have fallen below 95%. Unfortunately, I'm out of time on this question. I will yield to Senator Sanders, but I may come back because that question wasn't answered.
I can tell you we are laser focused on that. We have booths, testing booths, and institutions all over the games.